Hello and welcome to the SMP Senior Medicare Patrol podcast, Sip and Learn with SMP. Thank you for joining us today. I am Janetta. I am the Community Outreach Specialist for the Mississippi area. We also cover the state of Georgia. So today, our topic for today is going to be ambulance fraud. And of course, as always, we'll give you a little bit of information about the Senior Medicare Patrol program.
And I'm Brenda, the Community Outreach Specialist for the Louisiana area. But before we get started, I must say that this project is supported by a grant from the U.S. Administration for Community Living, Department of Health and Human Services, Washington, D.C. 20201. SMP is sponsored in Georgia, Louisiana, and in Mississippi by AdviseWell. So today, we're going to have a very interesting topic here at our podcast. And our first question is, Janetta, what does Medicare cover in relation to ambulance services?
Very good question, Brenda. Medicare covers ground and air ambulance transportation when all these criteria are met. When transportation is medically necessary, when wheelchair, van, or car could endanger the patient, when it is the only means of transportation for the patient safely, and when the ambulance and its crew meet certain standards. At a minimum, ambulance vehicles must be equipped with a stretcher, emergency medical supplies, oxygen equipment, emergency warning lights, and sirens. And also telecommunications equipment is required or as required by state and local laws. And also when the destination is the nearest appropriate facility that can treat the beneficiary's condition. So Brenda, what are examples of things that are covered? And also give us examples of things that are non-covered.
Okay, this is a very common question, and here are the answers. Things that are covered are, for example, the transportation to the hospitals, skilled nursing facilities, dialysis facilities for end-stage renal disease, beneficiaries who require dialysis, and return trips to the beneficiary's home when necessary. Things that are not covered are transportation from home to doctor's appointments, community mental health centers, psychiatric facilities outside of a hospital, or independent labs not connected with a hospital or skilled nursing facility. So those are very important that you keep in mind what is covered and what is not covered. Okay?
Okay.
So, Janetta, when does ambulance fraud happen? And what is an example of ambulance fraud schemes that we are seeing now?
Okay. Ambulance fraud happens when Medicare is charged for services that are not medically necessary or do not meet other strict standards. So Medicare Part B only covers medically necessary ambulance services with certain strict when certain strict criteria are met. So an example of ambulance fraud schemes would be falsification of documentation to provide the appearance of medical necessity when medical necessity does not exist, billing for more miles than miles actually traveled for transportation, billing non-emergency trips as emergency trips, billing a ride in a taxi or wheelchair van as an emergency transportation, billing the beneficiary instead of Medicare, even though the provider participates in Medicare and the trip meets Medicare coverage criteria. If any of these things apply to you, please contact SMP at our toll-free number, 877-272-8720, Monday through Friday, 8:30 to 5 Central Time. We also have a website for contact. It is www.stopmedicarefraud.org. Okay. So Brenda, tell us, what can we do to stop ambulance fraud?
Okay, Well, we can start off with reviewing your Medicare summary notice, or which we hear as MSNs, or your explanation of benefits, which is the EOBs, and look for the following. The services listed match what you actually received. Go through it and make sure that they match.
Okay.
Also, the mileage billed isn't more than the distance traveled. So if you live 10 miles from the hospital, make sure that it was actually billed for 10 miles and not 40.
Okay.
And that you were not billed for emergency transportation if it wasn't actually an emergency.
Okay.
So be on the lookout for upcoding or transport claims from basic life support to advanced life support. And because advanced life support vehicles must be staffed by at least 2 people who each must be certified as an EMT intermediate or an EMT paramedic by the state or local authority, where the services are being furnished to perform one or more advanced life support services.
Okay.
So after you've looked at your MSN or EOBs, and if you see something that you just don't understand or that you think may be fraud, or it's just a billing error, you can call Senior Medicare Patrol at 877-272-8720, Monday through Friday, 8:30 a.m. to 5 p.m. Central Time, or you can contact us through our website at stopmedicarefraud.org. These are the ways that you can reach out to us. And if you don't get a live person on the phone when you do call, leave us a message and you will get a call back the next business day if, for example, it's after business hours, but you can call at any time.
Yeah.
Okay, so Janetta, tell us about the prevention keys. S&P has prevention keys to help you navigate through fraud.
Sure. Prevention keys. Our 3 prevention keys are protect, detect, and report. Senior Medicare Patrol is here for you free of charge and ready to provide you with information needed to protect yourself from Medicare fraud and abuse, detect potential fraud errors and abuse, and report your concerns. Senior Medicare Patrol can help you with your questions, concerns, or complaints about potential fraud, errors, or abuse issues. Protect your Medicare card and your Medicare number. If you detect something on the Medicare summary notice or the explanation of benefits that doesn't look right, report it. Report it by calling the toll-free number 877-272-8720, Monday through Friday, 8:30 to 5 Central Time. So Brenda, tell us about the Resource Center and that healthcare tracker.
Well, as we said in the beginning of our podcast, we cover the states of Louisiana, Mississippi, and Georgia. But if you don't live in any of those 3 states, you can still get the help that you need. You can contact the Resource Center at 877-808-2468 or at smpresource.org to find out what your local SMP contact information is. They will connect you to them if you, again, live outside of Louisiana, Mississippi, and Georgia. This is a national program. We're in all of the 50 states and US territories and in Washington, D.C., and there is a number for each of the different states. So again, you can also call our toll-free number at 877-272-8720. And just for listening to our podcast today, if you call, you can request your My Healthcare Tracker. Okay, this is free just for listening. You can call and request it. And this will help you keep track of all of your doctor's appointments or laboratory appointments or just therapy sessions or whatever it is that you do for your medical needs. You can keep track of it in here so that when you do get your MSNs or EOBs, remember those summary statements, you can compare, because we may forget when we have a doctor's appointment and not remember. So this will help you keep track of everything. That's why it's called My Healthcare Tracker. It's free just for listening. So call us today at 877-272-8720. And this is a little token of our appreciation for listening today and learning more about fraud and the SMP program. There's also information about what the SMP program stands for. And again, it's a free service to you. We're here to be an advocate for you. Okay.
Thank you, Brenda. Yes, that was amazing. The healthcare
Yeah.
tracker can come in handy, that jotting down information and prescriptions and doctor's appointments. That's a great idea.
Yeah, definitely. And it's a really convenient little size where you can just like throw it in your purse or
Yeah.
backpack.
Yeah.
And that way, or even keep it in the car. You know, you can
Yeah.
put it in your glove compartment. And when
Mhm.
you go to the doctors, you can just keep track of your visits. And that way you have something to compare when you get your statements.
Yeah, it's a great idea.
Yeah. And
Okay.
it's free.
Yeah.
We love free.
Yes, we do.
Okay. So this
Hey.
has been an overview today here at Sip and Learn with S&P about ambulance fraud schemes. We want you to be aware that these things do occur and we don't want you to become a victim of that. So remember, we're here for you if you need help or if you need to ask any questions. We are here to help you navigate through all of that. So thank you for joining us today. We hope you join us again for more S&P content. We have lots of that. So you can just go to your favorite podcast platform and look us up and click on the topic that you think is of interest to you.
Yeah. Please join us again for the next episode of Sip and Learn with S&P. Until next time, thank you, Brenda. Bye-bye.
Thank you, Janetta. Bye, everyone.